All right. Good afternoon, everyone. My name is Elizabeth Roldan. I'm here from IMAC Insurance. We are the insurance broker for the district. We handle everything from your open enrollment benefit questions to claim matters. So even outside of open enrollment, if you have a question about your benefits or if you're experiencing an issue with a claim and how it's being processed, or even regarding your prescription coverage, please feel free to reach out to our office. We have an entire team dedicated to Essex County Schools of Technology, and you can call our office by dialing 973-450-9800, or you can send us an email at info@imacagency.com. I know that we are working to get back to people usually within the same hour, just to make sure that we are answering all of your questions related to your benefits, especially with open enrollment coming to an end on Friday, October 31st. So you have all the information that you need in order to make an educated decision regarding whether or not you're going to make a plan change or anything of that sort. So please feel free to reach out to us. We do want to have those one-on-one conversations with you with regards to, especially if you're considering moving to the educators plan or the Garden State Health Plan, that while both of those plans do offer savings compared to Direct 10 and Direct 15, there are plan differences that we do want to make sure that you are fully aware of, because while you may save money by moving into those plans, the benefits are different, and we want you to know what those differences are and how you and or anyone on your plan may be impacted by those plan differences. This open enrollment period began last week on October 1st and is running through October 31st. That is probably the biggest takeaway for today, is that open enrollment deadline. Because the district is bound by the rules at the state health benefits, that is a hard deadline of midnight on October 31st. If you do go to the office that Monday the 3rd and say to Donna or Claudine, hey, I forgot to do it, can you still get me in? The answer, unfortunately, is going to be a no, because the state will not allow any changes to be made past that October 31st deadline. So that's really a big takeaway for today. All of your changes are processed through the Benefit Solver portal. So something that we also like to forewarn everyone is that if you haven't been on Benefit Solver in a while, or if you've never been on it, please make sure that you take the necessary steps to have the proper access to it. In certain cases, you may need to have your username and or password reset, and it may require you to call the Division of Pension and Benefits to get that set up. And they are experiencing high call volume now, and I know that last week leading up to the end of enrollment will be a very busy week for them. I can tell you that almost every year we do end up connecting with an individual at some district or some local government municipality that misses the deadline because they didn't get their access in time to make their changes before open enrollment ends. And if you don't make those changes now, you would have to wait until the following open enrollment period unless you have a qualifying life event. So I can't stress enough how important it is to make sure that you have access to Benefit Solver. And while Benefit Solver is where you make the changes for your medical, please note that for any changes for prescription and dental, you would have to do that on the paper form for Benecard and for Delta. Those forms are on the IMAC benefits portal. And also, if you need a copy of them emailed to you, we can certainly do that if you reach out to our office. But again, please note that deadline of October 31st. And while this is a passive open enrollment, which means that you don't have to, if you're not looking to make a change, you don't have to take any action. We always recommend as best practices to make sure that you have access to Benefit Solver to double check that your information is correct, that the right dependents are listed there for you, that you're enrolled in the correct plan, and that your home address is up to date. Because if you're looking to make a plan change, and you go ahead and you don't update your mailing address, or you have an old one there in Benefit Solver, you're not going to receive your new ID cards if you're making a plan change or enrolling any new dependent children and or spouse. So please make sure that you do have access in your credentials to log into Benefit Solver. To visit Benefit Solver, you would go to the mynjbenefitshub.nj.gov address that we have listed on the screen right now. If you've never been on Benefit Solver, you will be asked to register, and that would require some additional demographic information such as your social, date of birth, full name, etc. And it's important that you have your cell phone next to you because even if you're registering or just logging in, there are security parameters there, and the system does require a two-factor authentication for you to go ahead and be able to log in and view your personal health information. So please make sure that you have your mobile right next to you, and you would enter in your username and password. And once you log into the system, this is what the dashboard looks like. Across the top, you will see a banner right now with a countdown to when open enrollment is ending. And again, that is a hard deadline imposed by the state, and you'll see how many days are left until October 31st. For those of you that prefer to go ahead and handle your enrollment via a mobile app, Benefit Solver's mobile app is called My Choice Mobile. This is what the icon of it looks like in the Apple Store or in the Android Google Play Store. So either way, you will have access to download this app, but you would have to complete your registration on the website first in order to be able to log in successfully through the app. For those of you that are looking to enroll a new dependent child for the first time, or if you've gotten married and you would like to add that spouse onto your plan, the state does require additional documentation to prove that that is your legal dependent. So please make sure that you do have this information available if you are adding that person on for the first time. If you already have your family or your spouse or your children all enrolled, you do not need to provide additional documentation to verify that they are your dependent. But if you are doing that, for example, for a newborn child, you would need a copy of their birth certificate. Or if you're getting married, you will need a copy of that marriage certificate and the joint tax return. But again, this is only if you're enrolling somebody for the first time. So for the 2025 open enrollment period, you do have 4 plan options available. You do have the choice between Horizon and Aetna. The Educators Plan is the only one that is offered only through Aetna, but through Horizon, you do have the same Direct 10, Direct 15, and the Educators Plan. And with Aetna, you have the same plan equivalents as well as the Garden State Health Plan. One of the questions that we get a lot is, well, what's the difference? Is there a difference in benefits? Is there a difference in savings? The rates are identical under either carrier. The benefits are also identical. Your choice here between carriers is really what network of doctors best meets the doctors that you want to see. So if your doctors are in Horizon, I can tell you that under Direct 10, for example, I can tell you that Direct 15 and the Educators Plan, all 3 plans under Horizon here in blue, share the same network of doctors. So there's no issue from an in-network standpoint whether or not your provider is going to be in the plan. And the same applies to Aetna, where the 10, 15, and the Educators Plan all share that same network of Aetna. But the Garden State Health Plan, however, under Aetna, does have a smaller network that they utilize. So again, that's something to consider if you're looking to go into the Educators Plan or if you're looking to make a change from carriers going from Horizon to an Aetna plan, for example. If you are someone that was hired before July 1st of 2020, you can elect from any of the plans every year. One of the biggest misconceptions and questions that we get from employees is, well, if I leave my Direct 10 plan, I can't go back in it if I go into the Educators Plan, and that's wrong. As an employee that was hired prior to July 1st of 2020, you can elect from any of the plans that are offered at every single open enrollment. But if you were hired after July 1st of 2020, you are only eligible to elect from the Educators Plan or the Garden State Health Plan. And that is the Chapter 44 law that was passed in 2020. We do have detailed benefit comparisons on the IMAC benefits portal as well as on Benefit Solver. I know in the communication that was sent out by Donna and Claudine, you did receive copies of those plan comparisons and overviews, but we also have them posted for you online as well. Another big question, and I know this year with the significant double-digit increase that is projected to begin in January, employees that are in Direct 10 or in Direct 15 are looking to see what their cost savings would be should they move to the Educators or the Garden State Health Plan. As you can see by the graphic that we have here, the Direct 10 and the Direct 15 calculate not only the coverage tier and your salary, but also the premium of the plan. All of those 3 of those are categorized in order to determine what your contribution amount will be. So every year that the premium increase, your cost share of that premium will also increase. However, in the New Jersey Educators Health Plan or the Garden State Health Plan, it's only based on your coverage tier. So again, if you're covering single, family, two adults, parent and child coverage, and your salary. So if you're not changing your coverage tier, or if your salary isn't increasing every year substantially, your renewal or your contributions will kind of stay leveled. So you have more stability from a contribution standpoint, staying in the educators or the Garden State Health Plan, just because the premium is not factored into that calculation. But like I said, if you're in Direct 10 or in Direct 15 and you're looking to move to the educators or the Garden State Health Plan, you are only at most committing for a year. You'll have open enrollment again next October, and you'll be able to, at that point, determine, well, I didn't save as much as I thought I would be. I want to go back to Direct 10, or maybe you're happy with the plan that you chose and you'll just continue to be enrolled in that plan. But at most, when you're making a plan switch, you're committing to it for a year because you have your annual open enrollment opportunity. So for example, this is the contribution table for the educator's plan. And let's say you're an employee that earns $75,000 and you have a family plan. If we follow the grid here, you're contributing 5.5% of your salary on an annual basis. And you would divide that by 20 pay periods if you're a teacher, for example, to determine what your per pay contribution is. There is a guaranteed savings. So in any, whether you're making 50,000 or 100,000, there is an inherent guaranteed savings that you will see moving into the educators or the Garden State Health Plan. But again, there are plan differences that we are going to be touching upon in a great level of detail, just to make sure that you have full understanding of what a change, how the change would be and what impact it may have on your coverages. The Garden State Health Plan also has its own contribution table. It is a 0.5% less than, it is half the percentage of the New Jersey Educators Health Plan. But again, we're going to be getting into why that plan is the least expensive one, just because of the benefit restrictions that it has. So when we talk about the New Jersey Educators Health Plan, that plan utilizes the same network of providers under Aetna and Horizon. So if you're in Horizon Direct 10 or Direct 15, the Educators Plan will use the same network there. Same thing with Aetna. If you're in Freedom 10 or Freedom 15, the Educators Plan would also use the same network of doctors. So anyone who you are seeing today that is just charging you a copay that is in network, they would continue to be in network should you choose to move to the Educators Plan. The Garden State Health Plan, however, as I mentioned, does utilize a smaller network of doctors under Aetna, and it's called the Aetna Whole Health New Jersey Network. And again, the big takeaway with the Garden State Health Plan is that it only has coverage in the state of New Jersey. So if you are traveling outside of the state, for example, I know a lot of teachers spend summers in Florida or traveling, and you're looking to, let's say, go to your primary care for, a simple thing like a cold, for example. There is no coverage outside of the state of New Jersey when you go into the Educators Plan. Or if you have a student that lives outside of the state of New Jersey because they're away at college, that's also a red flag to think about if you're considering the Garden State Health Plan. The contributions, as we mentioned, for both of those plans are calculated as a percentage of your salary rather than a percentage of the premium. And your copays under either Educators or the Garden State Health Plan are $10 at your primary, $15 at a specialist, $125 at the emergency room, which would be waived if you're admitted. But the two big differences between these plans and your Direct 10 or Direct 15 is the out-of-pocket costs are higher if you utilize out-of-network providers. And there is a different list of covered drugs, or a different formulary per prescription between both of these plans that also has a mandatory use of generics. So again, we're going to be talking about that, but those are the two big differences between the 10 and the Educators Plan. So please make sure that while the plan will work for you financially, it also has to work for you medically to cover the same either out-of-network providers or the same prescription drugs that you or anyone on your plan needs to be on. So this is just a quick side-by-side of all four plans together. So as we mentioned, the 10, the 15, and the Educators Plan all utilize the same network under each of the carriers. But under the Garden State Health Plan, however, it does have that smaller Aetna network and, of course, only limited to coverage here in New Jersey. Same thing with the national network. It is the same across the board under all the plans, except for the Garden State Health Plan because it's only in New Jersey. Your copays for your primary and your specialist will vary slightly depending on the plan, but they're usually around that $10 or $15 mark. And your annual physicals, which we highly encourage everyone to make sure that they partake in, are covered at 100% in-network only. So please make sure that you're taking advantage of those preventative services that are at no cost to you. And just, we always like to take the opportunity during open enrollment to discuss the difference between a deductible and a maximum out of pocket. So the deductible is the amount of money that you in a calendar year would have to lay out before your plan starts to pay out. So as you can see across the board under all 4 plans, there is no in-network deductible. If you go out of network, whether you're an individual or whether you have family coverage, you will have a different deductible that would be applicable if you go out of network. Maximum out of pocket, however, is the most that you would spend in a calendar year. So you have limits in network and out of network. And again, depending on the plan that you're in, you'll see that we have numbers for individuals as well as for family, if you have family coverage. None of the plans require a referral, so you don't need to designate a primary care physician. You don't need to get a referral. You can just go to anyone that is in your plan, whether you use in or out of network. We highly encourage that people utilize their benefits in network because that is really where you can control your costs better. And your labs are the same across the board as well. LabCorp and Quest are your in-network labs. And if you go out of network, you do have your applicable deductible and coinsurance. Same thing with outpatient surgery. You have coverage in network at 100% across the board. But if you go out of network, that deductible and applicable coinsurance would apply. And if you go to the emergency room, your copays will vary depending on the plan that you choose. But again, if you're admitted into the hospital, your copay would be waived. This is also a good opportunity that we like to use to make sure that you do know that urgent care is something that is very much available. It would be covered at the specialist copay. And for a lot of things that people tend to go to the emergency room on, they are covered at a lesser copay when you go to the urgent care, and also less of a wait time. The emergency room is really where you get the most expensive care because of just the amount of providers that are there available in the emergency room. So it's something to think about how you utilize your benefits to make sure that, are you going to the emergency room for a bad cold? Where maybe that's something that either your primary or urgent care would be best able to treat you at a lesser cost share as well. So when we talk about out of network under the educators plan, we do like to highlight that when you go in network to a doctor, that doctor is contractually obligated to only allow or can only charge you, excuse me, a copay. So they cannot bill you anything above that if they have a contract with either Horizon or Aetna. But when you go out of network, there is no controlling of that cost. Those doctors that are out of network do not have a contract with any of the carriers. They really can bill whatever they want. And even though you do have out of network benefits across the board, the insurance company is not paying a full 80% or a full 70% of the cost of whatever the doctor bills. They review the claim, and had the claim been in network, they determine based on that what they would have paid, and they pay their coinsurance based on that amount. So it's important to know that if you're being billed more than what the plan would have allowed, that is what is known as balance billing. And you as the member would be responsible for that should the provider bill you over that amount. We can tell you that if you are someone that goes out of network with a certain degree of frequency, for example, I meet and connect with a lot of teachers that are going out of network for mental health specialists, pain management, chiropractic, physical therapy, all of those services out of network that you're highly utilizing. And if you're going on a certain degree of frequency, that would be a red flag to consider before moving from the Direct 10 or Direct 15, because the reimbursement out of network for those services under the educators or the Garden State Health Plan is going to be much less. And what that means is that you're ultimately going to have higher out-of-pocket costs if you're utilizing out-of-network heavily under either of these two plans. So for example, if you're someone that is in the Educators Regarding State Health Plan, let's say your doctor bills $100 for that service. The insurance company, whether it's Aetna or Horizon, they're going to determine what that service would have been had it been in network. And in this scenario, let's say they decided that out of that $100 that was billed totally, they determined that what they would have covered it would have been at $50. Horizon and Aetna will go ahead and pay their 70% coinsurance or cost share of that amount, which is $35. You as the member would pay your 30% in coinsurance, which would be $15. But that other $50 that is still part of that cost, that total bill for that provider, that is what is known as balance billing. You as the member would be responsible to pay that bill in whole to that provider. And that $50 of balance billing does not get applied towards maximum out of pocket. And while this is a hypothetical, really high level, simple number example that we like to use, usually when members are going out of network, they're going to very expensive specialists, if you will. So these numbers could be very high. We work with members all the time on claim matters, and I can tell you that members sometimes don't even realize that they're going out of network. So that's why it's important to make sure that when you're speaking to your doctor's office, that you ask them, do you participate? If they participate, that means that they're contractually obligated to only bill you your copay. If you are calling a doctor's office and they say, yeah, we take all insurance, most of the time that means that they don't participate with anybody. And yeah, they'll take your insurance card, but they're not going to submit that claim to be processed. And you will be on the hook on an out-of-network cost for that. So it's important that you utilize the search feature either on Horizon or on Aetna's website to determine whether or not those providers are in network. But you can also call our office and we can do that research for you. So we love to connect with members one-on-one about that. The other big difference by moving into the Educators or the Garden State Health Plan is the prescription drug coverage. While both are offered through Benecard, your prescription drug coverage under the Educators Plan is a smaller list of covered drugs. It has a mandatory generics requirement. And it's important to note that while there will always be a drug for every single condition, it may not be the drug that you're on now. And if it does have a lesser expensive generic option available, that's what's going to be covered. So for example, if your doctor writes a prescription for Crestor for cholesterol management, um, Crestor is not a covered brand because it has a generic equivalent called rosuvastatin, and that is what's going to be covered under your plan. Generic drugs under the Educators Plan are $5. Preferred brand name drugs are $10. But again, if you or anyone on your plan is on certain medication that is not a generic, feel free to reach out to our office. We'll do that research for you just to make sure that the drugs that you're on now that you need to stay on, how they will be covered should you choose to move to one of these plans. So next steps, if you aren't making any changes to your benefits or adding any new dependents, you don't need to take any action. Your current plan will just roll over into the same as of January 1st, 2026. But if you are looking to make a change, you will need to complete for the medical portion of it on Benefit Solver, and you will need to make a paper form change for your prescription because your medical plan dictates what prescription plan you can go into. So if you're changing your medical from Direct 10 to the Educators Plan, you would also change your prescription from Direct 10 to the Educators Plan. So that's important to note as well. We highly encourage you to go ahead and make sure that you have your access to Benefit Solver, and you can utilize the IMAC portal as well to evaluate the plan information and review the contribution information. Or you can reach out to us and we'll run those numbers for you just to see what your cost savings will be exact. And again, you are making a plan election for the 2026 year. If come next October, you want to go back to your Direct 10, for example, that you are currently enrolled in, you can do that at the next open enrollment. So never think that because you leave Direct 10 that you'll never be able to go into it. Another question that we get a lot is that if I go into the Educators Plan now, is that going to affect my ability to make an election when I retire? Retiree benefits are completely separate and standalone from your coverages as an active employee, but I can tell you that whatever plan that you are in as an active employee bears no impact to what you're enrolled in when you're a retiree. The state is very firm on that, that if you are under the age of 65 and not Medicare eligible, you only have the option of the educators or the Garden State Health Plan. Those are the only two plans for non-Medicare eligible retirees. For those of you that will be retiring after the age of 65 and are Medicare eligible, you'll be able to elect from plans such as the Medicare Advantage plan, the Horizon 1525 plan, but Direct 10 is also not an option there. So Direct 10 and Direct 15 are not options at all as a retiree, no matter what age you retire at. So just that's important to mention that because we do get that question a lot. So as I mentioned, you're electing a plan for the 2026 year. You'd be eligible to switch plans during next open enrollment. And again, that big takeaway, please make sure that you are making your changes, if you are going to make changes, before that October 31st deadline. The IMAC benefits portal really houses everything and anything related to your health benefits. Outside of open enrollment, I know we update the portal a lot with a lot of health and wellness information. So please make sure that if you haven't bookmarked it yet, that you go to imacbenefits.com, and the guest key for Essex County is ECVTBOE. So those all letters all in caps, that is your way to log into the IMAC benefits portal, and everything that we've referenced today, for example, including that contribution calculator, which looks like this, is posted on the portal right now as well. So please make sure that you take advantage of it. And while we understand that this is open enrollment right now, open enrollment and life events really happen outside of open enrollment. So in the state health benefits, you do have 60 days to complete your enrollment and supply that documentation if you're enrolling a new member onto your plan on Benefit Solver. But if you are gaining coverage elsewhere and you're looking to terminate coverage, you do have a 30-day deadline. Coverage is retroactive to the date of the event. So for example, if you get married September 1st, but you don't get to enroll your new spouse until today, for example, you're still within that 60-day period. And as long as you do it within that 60-day period, you can have the coverage retroactive back to the date of the event, which in this example would be September 1st. Open enrollment is your annual opportunity to go ahead and make any plan or dependent changes with coverages taking effect as of January 1st. For those of you that have dependent children that are aging out, dependent children age out at the end of the year in which they turn 26. At the end of that year, dependent children will have the ability to be offered COBRA, and that's something that's sent out automatic. Chapter 375 is another option for those overage dependents that if they meet certain criteria, they can stay on the same prescription and medical plan that you are currently on at a much lesser cost than COBRA. And if you do have special needs dependent children, there is coverage continuation for those overage dependents with disabilities. And we do have forms and information about all of these three options on the IMAC benefits portal as well as on Benefit Solver. So if you are someone whose dependent child is aging out, Chapter 375 is a New Jersey state mandate that if that dependent child is not married, has no dependents of their own, and is a full-time student outside of New Jersey or lives in New Jersey and is not entitled to any additional group plan or Medicare, they can enroll in coverages for medical and prescription only at about 66.8% of the premium. That is something important to note because COBRA charges 102% of the premium. So it is definitely a savings so long as that dependent overage child meets this criteria. And you can go ahead and apply for that directly on the Benefit Solver website. And the billing would be handled directly by the carrier to you from State Health Benefits. And just as we're wrapping up, you can do your search for providers within the Horizon networks under horizonblue.com/Doctor Finder. But again, all three plans in the state offer the same network for all of them. So you don't really have to do a search if you're looking for somebody that you're already seeing in network under Direct 10, if you're looking to make a move to direct to the educators plan, for example. Under Aetna, you can also do the search there. And again, that would be aetnastatenj.com. And you would be able to search for the network under the Freedom 10, Freedom 15, and the Aetna version of the Educators Plan, as well as the different network that would cover the Garden State Health Plan. For members that do their preventative services within the state, NJ Well is a wellness incentive program offered to all state health benefits members, whereby doing preventative services such as your annual physical, dental cleanings, vision checkups, etc., you can accrue points to earn a $250 gift card not only for yourself, but for your spouse as well. The program runs every November 1st through October 31st, so we are nearing the tail end of the current plan year, but you can also begin that again on November 1st. And you can go ahead and enroll by visiting nj.gov/NJWell. We did also provide the 2026 plan overviews. So those were also emailed out and they're posted on both Benefit Solver and the IMAC benefits portal. And with that said, that really concludes our meeting for today. This is our information on the screen, so please feel free to give us a call or shoot us an email. We do want to make sure that we speak to you one-on-one if you're looking to make a plan change, just so you have all the information available. But other than that, we thank you for your time today. Donna, is there anything else that you would like to mention before we wrap up?
No, I think I'm good. Thank you.
Great. Thank you so much for coordinating this, you and Claudine. Thank you.
You're welcome.
Perfect. Thank you so much, everyone. Have a great rest of your day.
Take care, Elizabeth.
Thank you. Bye-bye. You too.